Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're here again on Monday night at 9 p.m. Eastern Standard Time to answer your questions live. Remember, we're also on Facebook, Instagram, and Twitter for additional content. Those will be linked into the description below. This is a chance for you guys to ask any questions that you might have of me here in the chat. So if you guys have any questions, please feel free to put them down there. And in the meantime, I'm going to answer questions that you guys have placed on some of the videos this week. For those of you guys who stick around to the end, I'm also going to go ahead and I'm going to give you a sneak peek at tomorrow's video. So let's go ahead and get started with some of your questions. So we are going to start this week with bleeding. I oftentimes do start with this because it is one of the most common questions that I do get. And so this particular question said, I am on my 5th week and I'm bleeding like I have my period. No severe pain. Is this normal? My last menstrual period was December 12th, and based on the transvaginal ultrasound, I am on my 5 weeks, 6 days with 85 beats per minute. So 85 beats per minute is referring to the baby's heart rate, is what I'm guessing that that's saying. And welcome to my cat. As far as the bleeding goes, this viewer mentions that they are bleeding the same as a period. So let's start there. What a lot of people don't realize is that the first month or two, you may still actually have a regular menstrual cycle. So your body doesn't always kind of kick in and realize it's pregnant right away. So some women right on the dot will get their period. Their period will look exactly the same as it always does, and they will go ahead and it will end and they don't even know anything has changed. In fact, this is why a lot of women will say they didn't know they were pregnant right away, because they continue to get a normal period. So it could just be a normal period. Now, at 5 weeks, so this says 5 weeks and 6 days. Ultrasound is not exact science. It is getting way more better than it used to be, but it is not an exact science. And while we have estimations of how to judge when you got pregnant based on your last menstrual period, those also aren't exact. All of that is kind of an estimate based off of looking at a lot of data and research. So it is possible that the pregnancy is actually younger, meaning it's 4 weeks or 3 weeks. If that's the case, some of that could be implantation bleeding. Well, implantation bleeding usually happens a lot earlier. It's not out of the realm of possibility that that is going on. Another possibility could be a subchorionic hemorrhage. Subchorionic hemorrhages are little pools of blood underneath the placenta that will sometimes leak out. Now, this early on, they're not really going to be able to identify for sure different structures like the placenta. They're not going to really look at that in great detail, which means that could be what's going on and you don't even see it. And we have a video on subchorionic hemorrhage that we are going to link into the description. Now, there are some other very common causes of bleeding early in pregnancy, one of them being sex. So sex, the hormones that are good for a healthy pregnancy, they thin out vaginal tissue and they can make you kind of dry and easy to tear. However, bleeding from sex would not look like period bleeding. And so this brings me to another one of our videos where I talk about like the colored bleeding and the amount. It's very important that you know what the amount is that you're looking at so you can describe it to a healthcare provider. And just so you guys know, when you're having discharge, when you're having bleeding, anything like that, as weird as this sounds or as gross as it may sound to you guys, take a picture on your phone. Okay. Sometimes you guys will say, oh, it was just like, some bleeding. And we're like, okay. And you're like, well, I have a picture. And we look at it and we're like, oh my God, that's a lot of bleeding. Or sometimes you guys will say, oh, it was like so much bleeding, like it's so like I'm hemorrhaging and it's like nothing. So sometimes having a picture to show us is actually very helpful because first we get a very accurate look at what you were looking at, and second, we can help teach you what you're looking at, and how to describe it in the future, which ultimately means you need to seek medical care if you are bleeding. There's many different causes of bleeding that can be treated. For example, if your bleeding is being caused by an infection, there are many infections that can cause bleeding, especially sexually transmitted diseases, and we can treat those, which will stop the bleeding. Additionally, sexually transmitted diseases, yeast infections, urinary tract infections, these can all put you at risk for miscarriage. So the sooner we identify them and get proper treatment on board, the better it is for everybody. And then finally, it could be hemorrhoids. Now, I know it seems crazy to think that hemorrhoids would cause excessive bleeding, and then, like, how would you not know it was a hemorrhoid, which is coming from the rectum? But believe it or not, that does happen. People don't realize where the blood is coming from. And so it's very important to let us check you out, because if you don't even know what a hemorrhoid is, you may not know that that's what's causing the bleeding. And we have a video on hemorrhoids for you guys to learn more about that. So ultimately, is it normal to have period-like bleeding at 5 weeks? Usually not. That does not mean you have to assume the worst. It simply means that you need to go get it checked out. And that's why we want to talk about that. Now, for those of you who are joining us, please feel free to put any of your questions into the chat. Right now, I'm answering some of the questions that we have from the videos. So we also got a question on my postpartum hemorrhage video. And so this one said, my second baby has been born, and after 2 months, my period started again. It's been 9 days since my period finished, but I still have bleeding. What should I do? So this is going kind of hand in hand. So first we were talking about bleeding during pregnancy. Now we're talking about bleeding postpartum. Having a period for 8 normal. Many women will start their period about 8 weeks after delivery, but you can go all the way until a year or more after delivery before you're getting your next menstrual cycle. All of this is normal. Okay. Now, a normal period, generally speaking, lasts for about 5 to 7 days, and you get it every 4 weeks, about every 28 days. This is like a normal cycle. When somebody says a period finished, that means the bleeding has stopped. Okay. So in this question, one of the things that is mentioned is that the bleeding continues. That means the period has not stopped. And it's important for you guys to know this, because it's important for you to describe things accurately. So if bleeding continues for longer than that, it might be normal. So when you have a baby, most people, their menstrual cycle will change. What do I mean by this? So I was one of those people that had a very short cycle, very light bleeding, no pain. I was very, very lucky before I had kids. Now, since having kids, my period is a little bit heavier, it lasts a little bit longer. And for the first time ever in my life, I started to have cramps. Now, were they terrible and debilitating like some women have? No, I'm still very fortunate in that respect. But did I sometimes, every once in a while, feel like I needed to take one Motrin? Yes. But that was a change for me. There are many women who have debilitating periods. Their periods are heavy, they're unpredictable. They have bloating and diarrhea and like nausea, and they have severe emotional distress. Very, very bad, debilitating periods. And then they will have a baby, and that all goes away. So the point is that once you have a baby, stuff changes in your body, and things may change related to your menstrual cycle. So for this person's question, if that is your first period since having the baby and it's going for 9 days, which is longer than you expect, that might be normal. That might be your body kicking back into gear. It might not completely understand what it's supposed to be doing, and it's kind of trying to figure that all out. So the most important thing to do here is to call your healthcare provider so they can get things checked out. So they can make sure you've healed properly and everything is going according to plan for your postpartum healing, and make sure nothing else is going on. Okay. But it can be normal to kind of be like a little off. Okay. For those of you who are joining us, please feel free to put any of your questions into the chat. So we had a question on pumping. So it says, I'm having a hard time getting my milk out. I feel like the pump is suctioning correctly, but my milk isn't coming out. How long do I pump for in the beginning to get my milk to come out? And how often should I pump in the beginning until a good amount of breast milk is being produced? So, for those people who choose to pump to get breast milk, if you're pumping only, you need to pump 8 to 12 times in a 24-hour period. You basically have to pretend that the pump is a baby who's eating. So, when it comes to the length of time, normal newborns will feed for approximately 20 minutes at the breast every 3 hours. So, that's where you get the amount, and that's the time you go for. Now, just like that's the frequency, you also want the pump to mimic what it would do. So, in order to stimulate more milk supply, most pumps they're designed that like the first time you put it on and turn it on, they're super fast for a minute, really fast. That is to mimic a baby's suck because at the breast, when the baby starts, in order to stimulate a letdown, the baby sucks and sucks and sucks and sucks and sucks. When the milk starts coming out, the baby's suck will change and it'll go from to a deeper, slower, rhythmic. And if you've used a breast pump, you'll notice that after that first 30 seconds or a minute that the pump is going fast, it switches into a slower, more rhythmic setting. That's to mimic a baby. Now, babies will try to stimulate letdowns multiple times during a breastfeeding session. So, a lot of these pumps also have a button that you can just push and it goes back to that fast speed for like 30 seconds. So, a lot of times we'll tell women to go ahead and push that button every 5 minutes to try to get some more milk to come down. Now, you need to be pumping around the clock. This is a big mistake people make. If you're trying to build and maintain a milk supply, the hormone prolactin, which is basically the hormone that says make lots of milk, okay? That hormone is highest at night, especially between like 1 and 4 a.m. So if you're not pumping at night, this is going to severely impact your ability to make milk. So it's extremely important that you guys are doing that. Now, one of the things this person says is, I'm not sure that the pump is actually emptying my breast. This is where you need to get involved with a lactation consultant. So you may have the wrong size flange. So the pump has like an opening where your nipple is going to go in, right? And this opening, this is your flange that you're putting your nipple into. And if that flange is too big or too small, you actually won't be able to produce enough breast milk and you won't empty your breast properly. So it's very important that you have that evaluated to make sure you're using the right pump. Now, there's a lot of different pumping tips that we have on our videos, and we have a couple of videos on some natural, like herbal supplements that you can use to help increase your milk supply. So it's very important that if you are trying to increase your milk supply, that you check out some of that stuff. Now, believe it or not, for anybody who's trying to build their milk supply, I actually recommend that you look at the sorry, the video I have on drying up your milk supply. So you may be like, why would I look at that? That's the opposite of what I want to do. Well, for example, if you didn't know that Benadryl or Sudafed will dry up your milk supply, you might use that because you have allergies, and then your milk supply is drying up after you put in all this hard work to build it up. Okay. So there's multiple things in the drying up your milk supply video that can actually be beneficial for you to understand when you're trying to build up a milk supply, because then you won't hopefully be doing things that are counter to what your goal is. Now, the other thing you guys want to look at, which is also not necessarily something people think of right away, but you want to make sure you know your health history and that you possibly visited a lactation consultant and discussed your health history. Women with polycystic ovarian syndrome, or PCOS, oftentimes have a higher incidence of not being able to produce a milk supply. They kind of run into two categories. Either they make too much or they don't make enough. So somebody with polycystic ovarian syndrome wants to be closely evaluated to see how that's going. Somebody who's had any kind of breast surgeries. So one of the things that can happen for some women who've had breast surgeries is they will make milk, but the milk will be trapped behind a breast implant. So they can feel the milk, they can feel the full ducts, and yet they can't get the milk out. Not common, but I have seen it. So that would be another thing that you would want to make sure somebody was looking into what was going on. And then finally, there are women who will say, I'm not making milk. I don't understand why. I'm pumping the way they're telling me. I'm doing everything. Everything is right, and no milk is coming. Well, one of the things we'll ask as a lactation consultant is we'll say, are you still bleeding really, really heavy? So this is, I'm talking about somebody who's like freshly postpartum, like 10 days out, 14 days out. So they're 14 days out, they're bleeding like crazy, and they're not making milk despite doing everything right. That usually means the woman has retained placenta. A little tiny piece of the placenta stayed embedded into the uterine wall. The way your body knows to start making milk is when the placenta detaches. Until that placenta comes off completely, your body still thinks it's pregnant. And so when a little piece of the placenta remains, that causes the body to keep bleeding. And the reason for that is because the uterus can't contract back down, so you remain bleeding. And your body has no idea you've delivered a baby, and therefore it's not making breast milk yet. So this is why it's very important to also talk with somebody if you are having trouble building up a milk supply. Lactation consultants are amazing. I'm a lactation consultant. I really think that's the first place to go. So that's one of the things I would have you look at. Your OBGYN may or may not be a good opportunity for you. If you have WIC, Women's Infant and Children, or you're involved in that program, they have a lot of CLCs. Those are certified lactation counselors. While they don't have the full on certification that IBCLC has, they have a lot of specialized training and they're very experienced, and you should not dismiss them as being inaccurate. They're usually fairly good resources. And then finally, if none of those are available to you, La Leche League oftentimes runs breastfeeding support groups, oftentimes in communities that don't have, say, a local hospital or local resources. And La Leche groups and La Leche leaders, while not necessarily formally educated in breastfeeding, certainly can be a resource. And most members are very devoted to breastfeeding. So if they identify something, while not a healthcare provider, they will usually advise you, hey, this does not look right. You need to go see your doctor. So it's another good avenue to get tips and tricks and stuff like that. So, hi, Alina. Oh, sorry, Emma. Sorry. Hi, Emma. I'm supposed to get blood work done to test estrogen, progesterone, FSH, prolactin, and LH after my miscarriage. I'm sorry to hear about your miscarriage. It's so hard. Is there a specific day of my cycle and time of day that is best to have this done? Okay, so this is a great question. Um, so specific day, no, unless you are dealing with an IVF physician. IVF physicians usually will tell you though. They'll be very, very specific on when they need you to go. What you do need to know when you walk in there is when is the day of the first day of your period. Okay. So you probably don't want to go if you're approaching your cycle, not because it's going to be inaccurate, but most women want to just say, okay, I had my period today, so now I can definitively say this was the day. Okay. That is the most important thing. Nowadays, we have a whole bunch of different ranges for these hormones based off of when you had your period. That's basically the ultimate thing. Now, as far as hormones go, early is usually better. Most hormones, the earlier you go is usually, the best idea. Um, Now there is something, hold on, I'm looking something up. Um, there's a particular vitamin that is not good. And I don't know if I am going to be able to remember it. B vitamins. You want to make sure that you are not taking B vitamins, especially biotin. Okay. You don't need to stop them like months in advance or anything, but like I would say like a week before you get the lab work done, those can interfere with some of your levels. The other thing you want to know is exactly that. When you go to get this done, you want to be able to tell your doctor, I was taking these vitamins and supplements. I would also stick to just regular vitamins and supplements. Um, Let me give you an example. Ashwagandha. Ashwagandha is a great example. So ashwagandha is really popular right now with a lot of people because it touts itself as being good for anxiety. And just so you guys know, if you're planning on getting pregnant or breastfeeding, I do not recommend ashwagandha because there is not enough data or research yet for us to even figure out anything about that. When you are pregnant, you just need to stick to regular vitamins. Don't go outside the box. But if you're not pregnant, your preconception, ashwagandha might be something you would take. This is a great example. Ashwagandha, one of the things it is known to help with is testosterone levels. So ashwagandha can actually increase testosterone. So I actually oftentimes recommend ashwagandha in short bits for my male patients because it can be taken for 3 months safely before you have to take a 4 month pause on it. So ashwagandha you can't take indefinitely. And it's good for men because it helps increase testosterone. Zinc is actually a very standard vitamin, but excessive zinc levels can actually boost testosterone. So you don't want to be too crazy on any of your vitamins because they could have effects on your hormones that you are not aware of. So when you go to get these done, if you're taking any weird supplements, other than like your standard like prenatal or something like that, I would stop them unless your doctor has told you otherwise. And when I'm talking supplements, I'm only talking vitamins, not prescribed medication. 1 week should be fine. And then let them know what you were taking at the time of your blood draw if something is abnormal. Okay, so I hope that that answered your question. Um, so, and anybody who has any questions, please feel free to put them into the chat like Emma did. I'm going to go to a question that we got on vitamin K. So the question says, does the hospital offer preservative-free vitamin K injections? So vitamin K is a injection that we give to newborns after birth. Vitamin K is a vitamin that helps us, all of us, to with blood clotting. So when you get a cut on your finger and it stops bleeding right away because it clots, a big part of that clotting system is that's responsible for that is built up by vitamin K. Now, we don't really absorb vitamin K that well in our diet and through our guts as human beings. So the way we actually get vitamin K is from bacteria. So not all bacteria is bad. In fact, there's a lot of bacteria that's very good and it lives in our gut and we have a symbiotic relationship. It lives in our gut, it helps us digest things, and everything's cool. And in exchange, it gives us vitamin K. It produces vitamin K for us. Okay. When your baby is born, your baby is sterile. Your baby's gut has never been exposed to anything. And the way we get that bacteria that is going to produce vitamin K for us is through the environment. It's through latching, it's through breathing, it's through everything. Okay. Once that bacteria comes into the body, it's not like it produces vitamin K at large amounts, like instantly. So the bacteria has to grow a colony and it has to settle in and it has to get doing its job. So in the meantime, your baby does not have enough vitamin K to assist the clotting system in its body. If the baby was to get cut or be in a car accident or something like that, the baby might have a life-threatening hemorrhage where the baby bleeds more than the baby should. This is why we offer the vitamin K shot. By giving a boost up front, we help to give the baby enough vitamin K to get that clotting system started and going until the bacteria can take over and do its job. Now, a lot of people will hear about oral vitamin K or vitamin K in formula or vitamin K in breast milk. None of that is wrong. All of that is absolutely true. There's vitamin K in breast milk, there's vitamin K in formula, and you can get an oral vitamin K supplement. Again, vitamin K is one of the few vitamins that the human digestive system just doesn't absorb as well. I'm not saying it doesn't absorb it, but it's not as good, not as effective. And getting big dose up front of the vitamin K just works faster. Okay. And so this is why it's so important for us to offer this. When I work in the hospital with people, when I have worked in the hospital with people, I used to tell them vitamin K is not a vaccine, it is a medication. Please separate these two out. I know vaccines are very controversial, and I try to stay away from infant vaccines because of how controversial it is. However, these are not the same. This is a medication, vitamin K. This is a vaccine if you're talking about like hepatitis B. So I always beg parents who are ready to say no to everything to please redo their research on vitamin K, to not put the two together and understand the risks of what they're refusing. Now, to the question, is there a preservative free version? So, the reason why this question of preservatives is coming up is based off of the whole autism debate that happened with vaccines. And so back in the day, this doctor who has now been completely discredited made an accusation that mercury and other things that were preservatives in vaccines were the cause of autism. This has now been completely debunked. This is not true. That being said, the controversy remains, and it has scared so many parents into not really knowing what to do. Parents are just trying to protect their children, they're trying to make educated decisions, and the vaccine schedule confuses parents. Because in the hospital, we offer a hepatitis B vaccine, and hepatitis B is transmitted through sexual contact and IV drug use, something a newborn is not going to do. So that further confuses parents into not understanding why we are doing what we're doing when we're doing it. When we talk about preservative free, that is most likely not an option in the hospital. In fact, it's probably not an option at all. If it is, that's awesome. But in order to mass manufacture these things, preservatives have to be in place because otherwise the medication wouldn't be stable. So unfortunately, there are preservatives in there. And to be very honest, because I have done a lot of research on this subject, an extensive amount of research on this subject, there's a lot of things in vaccines that aren't that cool. So I'm not going to sit here and claim that they've got like all these perfect ingredients in them. Vaccines do serve a purpose. So one of the things that some inactivated vaccines have is aluminum. So aluminum, you guys do the research. You guys are good at Google. I mean, hopefully you found me on Google, right? So aluminum is associated with different diseases. Okay, this is just something that's known, and so I'm putting it out there. But aluminum is put into inactivated vaccines because it is an immune system irritant. So, what does that mean? It means that your body, in order to make the antibodies it needs to from that vaccine, it's got to find these tiny little bits of virus that are dead that we just put into your body. And when I say tiny, I mean tiny. For all that liquid you might see, there's like microscopic amounts of these things. Okay. So it's got to go and find that. How in the world is it going to find this little tiny bit of whatever it is when it's dead? We got to put something in there that it is going to notice, that it's going to be like, heck just came into my body. It's one of the most common ones is aluminum. Now, it's not mass amounts, but it is there. And the aluminum is so immune system activating that the immune system just hones in on it. It's like a beacon. And when it gets there to deal with the aluminum, it goes, oh, wait a second. There's like another thing here. Let me figure out what this thing is and what I'm supposed to do with it if I ever see it again. And that's how you make the antibodies. So your baby has to be given mostly inactivated vaccines because the baby is immunocompromised. When your baby is born, the immune system is it's not developed. That's part of the reason why we have vaccines. And so you can't give a baby a whole bunch of live viruses because they would run the risk of getting that disease. And therefore, that's why we have to use inactivated disease. Therefore, we need something to attract the immune system there. When you're doing that kind of thing, you need a preservative in place in order to keep the vaccine stable. The preservatives do not use mercury in years. You're going to see people say, oh, but they use this sub thing that's like associated with mercury. No, there's no mercury. Okay. And what continues to be brought forward is very much a fear based thing. And what has happened now is some diseases that we had eradicated are coming back. A good example is measles. Mumps, measles, and rubella is one virus or one vaccine that's been put all together. And measles is now coming back. And measles can kill kids. Like we just think, oh, it's no big deal. No, it can kill kids. It has killed kids in the past 5 years because people aren't vaccinating anymore because they're scared. And as a result, these viruses are coming back. Another one that we encourage parents to get vaccinated for because babies can't get it when they're young is Tdap, specifically for the whooping cough, the diphtheria part of Tdap. That's whooping cough. For an adult, you may not even have a cough when you get it. For babies, it can kill them. I'm in South Florida. In Miami-Dade County, that is endemic, and there have been babies that have died. So vaccines serve a purpose. Now, it's everybody's personal decision, but understand the way that it's been created and designed was to make sure the most people got the most vaccine in a timely manner. And that's why it's all scooched into that little tiny time frame that you see. If you are thinking about whether you want to vaccinate or not, among other things, you can look for pediatricians who might support an alternative vaccine schedule and can educate you on the risks and benefits of that. So there are options. You don't have to feel bullied into something just because this is what they're saying that you need to do. I know about this kid with autism. So once my child was diagnosed, we stopped vaccinating until we could figure out as parents what was the best option moving forward. This is why I became so familiar with vaccines and how they work. I can tell you that my family is now fully vaccinated. Once I decided I had gotten enough information about how they worked, how our body worked, and everything moving forward, I am 100% personally pro vaccine because there are viruses out there that can kill us, and I don't want my family to die because I didn't choose to vaccinate. However, I did not do it traditionally, and I worked with my pediatrician to vaccinate my children on a schedule that worked for us. It was quick, it was not over long years of time, but it was different. And that's why I encourage you to do lots of research, ask lots of questions, but be open minded, even if you've heard something different. For those of you who are joining us, I'm Dr. Samantha, the maternity mentor. Please feel free to put any of your questions into the chat. I'm going to keep answering questions that we have gotten on the videos this week, unless I see something pop up. So I got a great question about RH factor, and it said, what happens if you choose not to get the RhoGAM shot while you're pregnant if you are RH negative? Will you have a complicated delivery? Just curious if no one happens to talk about it if you don't get it. So that's a slightly complicated answer, but we're going to go with it. So RH factor is the part of your blood that says whether you're negative or positive. So there's 4 blood types, O, A, B, and AB. And then everybody will be O positive or O negative, etc. Right? The RH factor is that positive or negative. When a mom is RH negative, so let's say she's O negative, and her baby is positive, let's say the baby is A positive, The baby's blood will mix into her body, and her body will sense that positive blood and look at it like a foreign invader and start to create antibodies against that. The RhoGAM shot basically prevents that. In a simplistic way, it helps prevent that immune system response. When you're in your first pregnancy, okay, your body, if you have an Rh positive baby, will not go ahead and attack the baby. It doesn't really know what to do. Again, when we kind of link back to vaccines, the first time you get exposed to an inactivated virus, your body doesn't know what to do with it. It's got to see it and make the antibodies for it. So the first time your immune system gets exposed to this Rh positive blood, it doesn't know really what to do with it, but it figures it out. So your next pregnancies are the ones that become at risk unless we give you the RhoGAM shot. And so what happens with the next pregnancies is basically it senses the blood and it goes ahead and the antibodies head to the placenta and they cross over the placenta and they attack the baby. They look at the baby as if the baby is a foreign invader. And when they go in, they're attacking the baby's red blood cells. So, red blood cells are the cells that carry oxygen in the body. So, when they attack the red blood cells, this causes the baby to develop anemia and have just less oxygen overall. This can cause growth issues with the baby, and it can really be very destructive. Now, if the baby has anemia, mild anemia is not really a big deal. But if the baby has severe anemia, cause actually miscarriage or stillbirth, it can cause heart failure in the baby. And then like mild Rh incompatibility can actually increase the baby's risk for jaundice. So when you're talking about this, it's extremely important for us to make sure that we're treating you so you don't have this immune system reaction and therefore you don't have antibodies attacking the baby. So that's ultimately what can happen. It doesn't complicate the actual delivery of the baby, but the baby can have health issues as a result. It's also important that if you become pregnant, that you understand what your blood type is, because if you have a miscarriage and you are Rh negative, you need to make sure that you are getting the RhoGAM shot after your miscarriage. When a full term or preterm baby is born, we test the baby's blood. And we test the baby's blood to see if the baby is positive or negative. If your baby is Rh negative like you do not need a RhoGAM shot after birth. But if your baby is Rh positive, we will give you a second RhoGAM shot after you deliver the babies. You get one around 28 weeks, and then you get one again after delivery. When you've had a miscarriage, we can't always figure out what the baby's blood type was, so we have to assume it was positive, and we need to give you RhoGAM to prevent that immune system response. Again, if you do not receive this, you can actually have repeated miscarriages because your body is attacking pregnancies of Rh positive babies, and you don't necessarily know that those babies are positive because you're early on. It is also important for you to be mindful of getting the RhoGAM shot, even if you think it's your first pregnancy, because there are many women who will have miscarriages without ever knowing that they were pregnant at all. Miscarriage is very common. And so we're understanding that more and more. And as I said earlier with the bleeding question, you could be bleeding thinking you're having your period and it could be something different. Okay. So that's why you need to know. But that's the question about that. Um, so we had a question about drying up breast milk, and it was how often do I drink and how often and how much do I drink sage tea to dry up my breast milk? So we did link earlier herbs to dry up your breast milk supply into the chat, so you can check out that video. But sage tea is one of the things that you can drink, and the quick answer is a half a cup of sage tea twice a day. That can help to dry up your milk supply. We had a question, and please, anybody who has any questions, please feel free to put them into the chat because we only have a couple more questions that came in on videos. We have a question that came in on the gestational diabetes video. I am 27 months pregnant and I've been diagnosed with gestational diabetes. Can I take orange juice in the morning because I love to drink it? The answer is a resounding no. So, gestational diabetes is where you have trouble processing sugar. Your insulin isn't working, you can't process your sugar correctly. You need to eat a low carbohydrate diet. We have videos on some great foods to eat when you have gestational diabetes, as well as a video on the ketogenic diet, which I think is great for helping with gestational diabetes. So I need to check that out. But you want to reduce your blood sugar when you have gestational diabetes, which means you need to focus on proteins and healthy fats with carbohydrates or sugars being the least amount. Orange juice is a complete no. It's 100% sugar. There's like no value. A lot of people will say, but oh, it has vitamin C in it. You can get vitamin C from your prenatal vitamin. You can get vitamin C from lower carbohydrate fruits like strawberries, for example. Strawberries are an excellent source of vitamin C. They have a lot more fiber and they have a lot more nutrients, and they are far lower in their glycemic index. That means how much sugar they have. So you can get that from other things. Some people will say, "Oh, but I squeeze my orange juice or I get fresh squeezed orange juice." Just so you guys know, when you are pregnant, you should not be buying fresh squeezed juice in random stores. So some of those juices will actually contain bacteria and stuff that can make you sick if you're pregnant. If you're squeezing your own juice where you've cut the fruit and you're squeezing it yourself, you should be okay. But in some of those like farmers markets and stuff, they have the fresh squeezed juice. I'm not even saying that they haven't done it that morning. They may have, but those things can start to build up bacteria and stuff in them that, might not be good for you because pregnant women are immunocompromised. So just like babies immunocompromised afterwards, a pregnant woman is considered immunocompromised because her immune system needs to calm down, or it would always look at the baby like a foreign invader and just constantly being like very reactive to anything the baby's doing. So as a result, we're a little immunocompromised during pregnancy. That's also why they tell you to avoid certain foods when you're pregnant, because you don't have the resources to be able to combat certain infections you could gather. And I'll tell you guys what something that's funny is that one of the common infections people get from food when they're pregnant is E. coli. And it's very common actually to get E. coli illness, E. coli poisoning or whatever from lettuce. And if you pay attention to the news, when they have recalls of lettuce, it's usually from E. coli. And I can't tell you how many times I've listened to OBGYNs come into the patient's room who has E. coli and say, hey, have you had Caesar salad recently? And if they say yes, they will tell them how to wash the lettuce. As silly as that sounds, it's very common. And it's usually because people don't know how to wash the lettuce. So there you go. Make sure you wash your lettuce very well. Now, with gestational diabetes, you want to make sure you're reducing your sugar content. A lot of people get very dizzy and they'll get heart palpitations when they are pregnant because they're dehydrated. And I find that sometimes that'll even make you think that you have anxiety. So, one of the most common things I'll recommend to a lot of my patients is to drink Gatorade. Well, what I always say to women who are about to get pregnant, who are pregnant, or if they're postpartum, is to do sugar free Gatorade because you don't need the sugar. Sugar is just not our friend. Um, if you're talking about dairy products, one thing that's very backwards in our line of thought related to diet is people want to get fat free. Always get whole fat, like milk, for example. So, full fat milk is it does have fat, but that fat is healthy animal fat associated with the milk. When you take that fat out of milk and you have the fat-free milk, first of all, you guys will notice it's thinner. It looks more watery, but what's left is basically sugar water. You took out the only thing that had a better nutritional value to all of that. Sure, there's a little bit of protein, but it's basically sugar water. So when you're talking about dairy, you want the fat in it. And because that's the healthy part of dairy, believe it or not. So I hope that answered your question, but the absolute answer is no, you should not be drinking any kind of juice if you have gestational diabetes. Um, I am Dr. Samantha, maternity mentor. Thank you guys for coming. I have one more question that I'm going to answer now. So if you guys have any questions like Emma did, please feel free to put them into the chat because I'm almost done. And if you guys see, I will give you a sneak peek at tomorrow's video. So my last question wasn't really a question, it was actually a comment. And it came in on the postpartum depression in fathers. And it said, I've smoked so much weed, I've lost feeling. I feel like a robot just replaying every day since my son was born. I went to my grandmother's funeral and the next day found out my girl was pregnant and just started a new job, shaking my head. So I felt it was important to read this comment because I feel like it was so honest and raw. And it's so hard for a lot of dads to be able to put themselves out there and say these things. So, postpartum depression in fathers or partners is something that I am very, very passionate about. I actually did part of my doctoral project on that. And I've gotten specialized training in it. And I move forward with it because determined what I've realized is that postpartum depression in fathers is as prevalent as they say. 50% of fathers will develop postpartum depression if the mom has postpartum mood disorders. That could be anxiety, PTSD, OCD, depression, etc. So dads are at high risk, right? But dads are supposed to be the support person. They're supposed to be there to help the mom who's doing all this recovering and adjustment and stuff. So if dad doesn't feel good, how is mom supposed to feel good when she's basically reliant on a person who doesn't feel good? So it's a very complicated story. And I've done some talks. We actually have one of the talks. I think it's listed as shorts on my channel, but there's some stuff there. And I have told like people in my talks that believe it or not, it is extremely important to allow your partner to be going out for self-care. If that's going to the gym, if it's sitting at home playing a video game for 2 hours, once a week, whatever it is that feeds their soul, they need to be able to do that as well. Now, obviously, I understand that when a woman has a baby, like it's her show, right? Like she's done a lot of work and she needs a lot of help. I get that. I truly get that. But if we don't allow dads the chance to also recover, then they're not going to be a good partner for the moms. They are their own person. They still have their own needs. And it's important to recognize that and support that. I think right now our society is just quick to go, look what she just did. Like, no, why are you asking for anything? That is not right. That is not supportive. And it does not ultimately help mom. I need to make that clear. This is something that seems to be this huge disconnect. The other thing is dads become gophers. We tell them, go get this, go get that, go do this. We start in the hospital doing this. Healthcare providers will be looking at dads going, go get the ice, go get this. You send a message to a dad that their place is away from mom. And then we complain when they're out doing things. And it's ironic because we will complain that they're out working, right? That they're not there doing enough in the house, but the only message we've ever sent them is to go away. And that includes like bigger picture, like the government who doesn't offer paternity paternity leave. Okay. So it's not just small, it's big. This dad gives us a very honest look at what the experience sometimes is. And it's something that we need to understand happens and we need to support them as much as we can. Moms definitely need a lot of support, but dads do too. And it's okay if you don't feel well, ask for help, tell people. And for both men and women, Postpartum Support International has support groups out there for everyone. They have postpartum support groups for dads and moms, for military people, for people who've had miscarriage, for people who've had infertility. Their support groups are mostly online. These are great avenues. And for dads to get into a support group online and hear that you're not alone can be so invaluable. Hi, Gabriella. I'm 5 weeks postpartum. I'm not breastfeeding. When will my menstrual cycle return? Approximately how many weeks? So, this is a good question. There is absolutely no way to know. Usually about 3 months because you still have a lot of hormones that are adjusting because you just had a baby, but usually about 3 months. But this brings up one very, very, very good point. Whether you are breastfeeding or not, you are usually cleared to have sex at 6 weeks postpartum. Once you are cleared to have sex, you need to know what your birth control plan is, whether you are breastfeeding or not. So, breastfeeding is always touted as potentially this ability to prevent pregnancy. Okay. And the way they say that happens is because it prevents you from ovulating. And because you don't ovulate, then you're not releasing an egg. So then you can't fertilize and get pregnant, right? And with formula feeding moms, oftentimes we have to be a little bit more careful because their period's going to come back sooner and they could get pregnant. What many people don't realize is they will silently ovulate for 1 to 3 months before actually seeing a period. So let me say it again. Silently ovulate. You release eggs at a regular interval as if you were having a period, but you don't actually bleed, which means you can get pregnant. And a lot of people, when you hear about somebody who gets pregnant when the baby's 2 months old, so now they're having two babies under the age of one, what happened was they will say, I didn't get my period, so I didn't think I could get pregnant. That is not true. So you could already be ovulating, Gabriella. There's no way to know. And if you haven't had sex yet, if you're about to plan to have sex, you need to make sure you have birth control on board. Now, some women will say, I don't want to use birth control pills. I don't react well, or I'm thinking about having a baby in a year, or I don't want an IUD. That's all fine. It's all totally cool. Um, Condoms, the sponge. Um, you might want to do diaphragms. They're old school, but you can do it. The pull out method, which is where a man and a woman will have sex with the penis inside the vagina. And when the man is ready to ejaculate, he pulls out and ejaculates outside of the body. That is not effective birth control. I have seen many unplanned pregnancies that way because even though he ejaculates outside, there is sperm that is released prior to ejaculation, and it can be released 10, 15 minutes prior to ejaculation. So it's not like 10 seconds before, it's like the entire time you're having sex, this could be released. All it takes is one sperm. That's it. All you need is one. So please understand you want to plan for birth control because you can silently ovulate and get pregnant. I hope that answers everybody's questions. My name is Dr. Samantha. I'm the maternity mentor. I'm here every Monday at 9 p.m. Eastern Standard Time to answer your questions live, as well as to answer any questions that you guys have put onto the videos. We also look for suggestions. I'm the one and my husband, we are looking at these questions. We are responding to you. We take your questions seriously. I love what I do. I love getting on here and talking to you guys. I definitely like the suggestions because you guys have some of the best ideas and they're things that I love sharing with you. I love sharing what I know. Now, for those of you who stuck around, I am going to tell you what tomorrow's video is. So tomorrow's video and I think it was fitting that we had a discussion on dads tonight. Tomorrow's video is the top 10 gifts that you can give a new dad postpartum. Last week was new mom. This week is new dad. New dads deserve to be celebrated just like moms. Just like a mom becomes a mom when she first delivers her first baby, a dad becomes a dad at that time too. So both moms and dads should be celebrated, and dads deserve a gift as well. So check out. They are not baby related gifts and they shouldn't be. This is about just, hey, listen, congratulations. And so I hope you enjoy the video tomorrow. It will come out early in the morning. For those of you who have joined me and are supporting me, thank you so much. Please, please, please subscribe to the channel if you haven't. That really, really supports us, content creators. We need that. For those of you who aren't aware, we just got approved for YouTube Health. So we're part of that platform that allows you guys to know that this is content coming from a verified health professional. So I had to prove that I was actually who I said I was. So I hope that you can trust that we're here to give you good thoughts and good content. I really appreciate everything. Thank you so much for joining me. I am Dr. Samantha, the maternity mentor. Bye for now.